Now we will discuss the neurovascular supply of the lung. First, the arterial supply of lung. Right lung is supplied by only one bronchial artery. Basically, the bronchial artery will give the nutrition to the lung mass. It arises from the third most intercostal artery or upper left bronchial artery, while the left lung is supplied by two bronchial arteries. These arise from this descending thoracic aorta, upper opposite 5 thoracic vertebra, and lower below left bronchus. Then the venous drainage of lung. Two bronchial veins on each side drain the lung. Right bronchial vein drain into the azygous vein, while the left bronchial vein drain into the hemizygous vein. Greater venous drainage by the pulmonary veins. As we have already discussed about the bronchial arteries and veins, then what about the pulmonary vasculature of lungs? Basically, it composed of pulmonary arteries and pulmonary veins, two pulmonary arteries and four pulmonary veins. These pulmonary arteries bring deoxygenated blood from the heart toward the lung for gaseous exchange, and after gaseous exchange the oxygenated blood is returned from the lungs to the heart through these pulmonary veins. The gaseous exchange takes place at the precapillary anastomosis level between the bronchial and the pulmonary arteries. Now comes the lymphatic drainage of lungs. There are two sets of lymphatics which drain the whole lung tissue. It composed of the superficial vessels and the deep lymphatic vessels. They both drain into the bronchopulmonary nodes. Superficial vessels drain the peripheral lung tissue. It passes round border of lung and fissure to reach the hilum. These vessels have numerous valves, while the deep lymphatics drain the bronchial tree, pulmonary vessels and connective tissue septa. They run towards hilum to drain the bronchial tree, and these vessels have few or no valves. Our next learning outcome is bronchial tree, the components of the bronchial tree. As we all know that the trachea divides into the right and left main bronchus. Then they divide into the lobar bronchi, the secondary bronchus, then give the segmental bronchi known as the tertiary bronchus, then further divide into the terminal bronchioles which give the respiratory apparatus or where the gaseous exchange take place. From the respiratory bronchioles there are the alveolar ducts, sacs and alveoli. This is the diagrammatic representation of the whole bronchial tree. As we can see the larynx, then trachea. At the level of the carina, the trachea divide into the right and left main bronchus or primary bronchi. The primary bronchi divides into the secondary bronchi, which further divides into the tertiary bronchi and then gives the terminal bronchioles. These terminal bronchioles further divide into the respiratory bronchioles, which is basically where the gaseous exchange take place, the alveolar sacs, the alveoli. We can see in this diagram the terminal portion of the whole pulmonary tree, the alveolar sacs, the alveolar pores, the alveolar duct, and these are the capillaries where the gaseous exchange take place. Till now we have discussed the lobar division of the lung is left lung is divided into two lobes and right lung is divided into three lobes. Now lobes are further divided into some segments known as the bronchopulmonary segments. These are well-defined sectors of lung aerated by a tertiary bronchus. Each segment is in pyramidal shape with its apex directed toward root of lung. We can see in this diagram this pyramidal shaped segment. It has the segmental bronchus, segmental artery, and autonomic nerves and lymph vessels. Segmental vein is not included in this bronchopulmonary segment. This shows the diagrammatic representation of the bronchopulmonary segments in both right and left lungs. In the right lung, the upper lobe contains the apical, posterior, and anterior segment, while the middle lobe contains the lateral and medial segment. The lower lobe has superior, medial basal, anterior basal, lateral basal, and posterior basal. This basal name is given on the base of the area around the base of the lung. Likewise, in this left lung, in the upper lobe, it has apical, posterior, anterior, and the lingula, which we have already discussed, is the tongue-like projection of the upper lobe towards the cardiac notch. It has the superior lingular segment and inferior lingular segment, and the left lobe has posterior, medial basal, anterior basal, lateral basal, and posterior basal bronchopulmonary segments. These segments are separated by thick intersegmental septas, which has a clinical importance, clinical significance, which we will study later. So, the clinical significance of these bronchopulmonary segments, first, that due to the restricted segmental neurovascular supply, the infection cannot be transferred or cannot spread from one segment toward the other. Therefore, it is easier for a surgeon to remove only the infected portion of the lung, infected segment of the lung. So, segmental resection can be made easy, refers to single infected segment can be surgically removed without affecting its neighbor. Infection never crosses the intersegmental septa and are restricted to one bronchopulmonary segment except the tuberculosis and the cancer, which can spread or which can metastasize from one segment towards the other. Next, the postural drainage. Excessive accumulation of secretions in bronchi may lead to infection. So the drainage of these segments allow for the postural drainage. Postural drainage, such secretions can be drained out of the lungs by placing the patient in a posture that helps the fluid to drain from the lungs by gravity. The common position for this postural drainage is left lateral position. As the right lung is more oblique, more vertical in shape, so all the secretions come out along the gravity action. This was all. Thanks.